Hey guys, Curtis Alexander at curtis-alexander.com. In this video, I will be talking about the side effects that you can see from Tamsulosin, also goes by the brand name Flomax. I'll go over what it does in your body, which will help you understand the most common side effects you can see. I'm also going to go over a couple of groups of people that would want to be really careful about taking it, go over some drug interactions, that kind of thing. Also go to curtis-alexander.com, get your free report where I give you some natural therapies that can help you get away from drugs and surgery. So let's get going. So with Flomax, how it helps the prostate, it's what they call an alpha 1A blocker. And you have alpha 1A receptors all over in your body, but in particular in the bladder and the prostate. So by blocking this receptor, we see the smooth muscles relax in the bladder and the prostate, which allows more urine flow, and also the symptoms with the prostate problems go down, which is a great thing. But like I said, you also have these alpha receptors in other parts of your body, namely in your vasculature. You have them in your guts, your intestines, you have it in your heart and your liver. So we're not just blocking alpha receptors in the prostate and the bladder, it's other parts of the body, which is where we see some of these side effects pop up. The most common ones we're going to see, first of all, is headache, 19 to 21%. A big one, and we'll talk about this in a second, some of the risk factors, but orthostatic hypotension. So going from a seated to an upright position or lying down to upright position, you can see a big drop in blood pressure, orthostatic hypotension. Interestingly, the first dose effect from it is roughly 6 to 7% of people will see that. But with chronic use, your chance of the orthostatic hypotension goes up to 16 to 19%. We can see rhinitis in 13 to 18% of people, basically a stuffy nose. Interestingly, people will ask, particularly men who take it more often, can there be sexual side effects? You can see ejaculatory failure in men. 8 to 18% of men can see that, so it is a risk factor. Dizziness, 15 to 17%, and infection, interestingly, 9 to 11%. So it does come with some side effects. Hopefully you understand some of those based off how it acts in the body. There are some warnings. I was talking about groups of people that we want to be really careful with. One, and it's a very rare thing, but it's important for you to know about, it's called intraoperative floppy iris syndrome. And basically, what we believe is happening is that it can inhibit iris smooth muscle. Remember, we're blocking these alpha receptors, and they're in different parts of the body. So when we do that, we can see this floppy iris syndrome. It is not common, but we tend to see it. The suggested kind of warning time is within 3 months. If you've used the Tamsulosin 3 months, it is by a lot of people considered a risk factor for this if you were to go through that surgery. So actually Tamsulosin, as far as the alpha blockers themselves, Tamsulosin is the highest risk for this. If you have high blood pressure, you're at risk for this. If you're a man and your older age, generally they say older than 65. Again, it's a rare group of people, but something to be very aware of. The other one is orthostatic hypotension, which we talked about above, but I want to go into a little more depth because there are certain groups of people that are going to be at higher risk. First of all, the good news, Tamsulosin out of all these alpha blockers is the lowest risk for causing it. It can still do it as we talked about, but it is a low risk. If you've stopped Tamsulosin and then started again for whatever reason, that's a risk factor. If you try to increase the dose too fast, you get a rapid dose increase, it increases your risk of the orthostatic hypotension. And there's other meds that can cause orthostatic hypotension, things that dilate the blood vessels, a lot of heart medications, and that can increase your risk of it. Finally, we see an increased risk if you drink alcohol. So things to be aware of. I would love it if you've taken Tamsulosin, you know somebody who has. Did you experience side effects? If so, what were they? Let me know in the comments. It's very helpful for me it's very helpful for the other people that watch the video to learn from your experience. So speaking of helpful, I hope this was, and I'll see you in the next one. Thank you.